We want to make sure that public health access is available to everybody, and that means a number of things. One of the first things I think that we need to take a look at is what does it cost to get health care in the state? And we need to make sure that we advocate and we actually provide access to a single-payer health care system that provides universal health care coverage to all Connecticut residents. This will actually make it so that we have much healthier residents. It will also make it so that we are able to reduce our costs here at the state level. And that is a key important point. We need to make sure that health care is a right in our state statutes, because that is something that will make sure that our people have access to the right kind of care. We need to make sure and try and do a pilot program with a Medicaid program to expand and include full parity for certified nurse, midwives, and birthing attendants. A few years back, we were able to give the advanced practice nurses a chance to operate on their own. This is something that was really supported by our FQHCs, our federally qualified health centers, and they really were able to also utilize the services of the advanced practice nurses in the area of mental health. So this is a place where we can really expand those resources that we have here in Connecticut and make sure that our advanced practice nurses can operate to their fullest extent. We want to be able to hold the pharmaceutical companies accountable. And when they promote harmful things for profit, like fentanyl or OxyContin that creates addiction, we want to make sure that when we find out that there is a problem with these types of medications and how they're being marketed to the medical profession, that we are able to make them and help make them accountable and hold them liable for those types of things. And we want to reinvest in that opioid and treatment access, because making sure that people understand what addiction is. It's not just about opioids. It's not just about a particular drug. It's about gambling. It's about eating habits that are addictive. It's about any number of types of addictions. And we need to be able to focus on addiction and see how we address addiction in the state of Connecticut as the root cause of many of the problems that people have that turn into disabilities and long-term life problems. So we want to be able to do that. Also, making sure we invest in our infrastructure with respect to water and sewer and those kinds of resources, and making sure that we have access to resources that we do. And we're working on different programs to address those kinds of issues. We want to make sure that the potential use of harmful substances that might be addictive, also like teen vaping and those kinds of things, that they actually are in a situation where people get community education. With a chance for us to legalize recreational marijuana, we want to make sure that we do a great deal of community education so people understand exactly what's going on, what kinds of protections we will have for people who may actually indulge in the recreational use of marijuana. But we also want to point out that this is going on in New York, Massachusetts, Rhode Island, all the surrounding states have it, so it's important that we begin the education process right now and make sure that the people who are in this circumstance and might be utilizing these kinds of things actually have information, because a lot of the times we forget that just educating our young people about addiction and these different types of things that are out there in the economy that maybe aren't good for them, that they will be able to learn that these kinds of things aren't the kinds of things they want to use.